Okay, it looks like it's time for us to go ahead and get started here. Hello, everyone, and welcome to this month's Northwest ATTC webinar. I'm Jennifer Verbeck, and I'm your host for today. We've had a slight change in schedule, and we'll have one presenter instead of two, as we previously mentioned in our advertising. We're excited to have Dr. Dominique Simon-Levine presenting for us today on digital health services to address addiction in families and patients, and she'll be going over the Allies in Recovery program. A couple of quick housekeeping things. First, if you have any questions for our presenter, please type them into the chat box at any time. And after she's done speaking, I'll read the questions in the order that we received them. You'll also be getting an email at the end of today's webinar with a link to a survey in it. So please take that survey. It helps us make sure we're bringing you the content you're interested in. That email will also have a link to download the slides from today and a link to our website where you'll be able to find a recording of the webinar, and that should be available later this afternoon. Additionally, we'll be sending everyone who attends this live webinar a certificate of attendance, and that takes us about a week to get those out. You don't need to do anything to get the certificate unless you're watching this in a group, and in that case, please have someone in the group email us within a business day with the names and email addresses for everyone who wants a certificate. And you'll see our email address up there on the slide. It's northwest@attdcnetwork.org. Okay, and on to our webinar. As mentioned earlier, today's speaker is Dr. Dominique Simon-Levine, who has over 25 years of experience evaluating innovative projects to address addiction. She is also the founder and CEO of Allies in Recovery program, which she'll be presenting for us today. So I'll pass this over to you, Dominique. Thank you so much.
Thank you. I'm very glad to be here today. There's a lot of hurt right now in this country. Nowhere is this more true than inside families experiencing active addiction. What I'm going to show you today is the best of what science suggests is the behavior and the interactions that can succeed in reducing stress and conflict between a family member and a loved one with addiction, and in engaging that loved one to seek help and enter recovery. It's my understanding that most of you are clinicians or case managers. You're therefore on the front lines of this dual epidemic of COVID and substance disorders, and you must be seeing an incredible rise in active mental illness. Conditions for care are not ideal. Showing up to group therapy on video is a big change. We're losing people. People are overdosing alone or withdrawing at their parents. The daily structure of life is gone for many, like a job or a therapy group, and this is not good news. I have met amazing, compassionate, intuitive, and skilled clinicians and case managers over the years I've worked in the Springfield, Mass area with not-for-profits and the local county jail. I'd like to take a moment and thank you all for everything you're doing in addition to your full-time workload with the advent of this COVID crisis. I'm here today to take some weight off your shoulders. Many of you are here to listen to me talk about a family program, and you don't work with families, so you're probably going, well, you know, what am I going to do with this? Right after this webinar, you'll be able to do everything I'm showing you free and on the internet, both for yourself and for your patients, your clients, and your clients' families. These tools are going to be free throughout the COVID period, and they represent the best of what science says works for both the family and the person struggling with addiction. There we go. Before I start, I want to make a distinction, between family support and family training. There's a lot of growth in family support around the country, a lot of self-help groups and family groups that are being formed, a lot of moms and other people who have struggled with addiction and either one or sadly have lost a loved one to addiction. They're taking that passion and that grief, and they're turning it into support groups around the country. So a support group is for you, the family. You learn about addiction, you can share, you can unload, you connect with others, and you can find local resources. It's very important to have these support groups. What you might not know is that there's actually family training, and that's different from family support. Family training educates about addiction and how to find treatment. And you get to learn and practice new skills that improve the family functioning and that encourage recovery. With our site, Allies in Recovery, we do some family support. We are supportive in our work, but our focus here is on training the family in the essential skill set that family member needs in order to address the addiction in the family. Rather than take you through a demonstration of the site, I'm going to give you a little brief presentation that we put together that shows the Allies in Recovery site.
1 in 10 Americans, the equivalent of the entire population of Texas. That's how many Americans are currently suffering from drug or alcohol addiction. As a professional in this field, you know that addiction often goes hand in hand with financial stress, family conflict, darkness, and desperation. Thankfully, there are skilled, compassionate doctors, nurses, social workers, treatment providers, clinicians, and pharmacists, people like yourself ready to help those who do seek treatment. But a government study found that 50% of people who know they have a problem with drugs or alcohol are resistant to getting help. How can we get more people into treatment and better support their recovery? By teaching the family to become an informed agent of change. By teaching the family how to become an ally in their loved one's recovery. We are Allies in Recovery, the online home for the families of those struggling with substance abuse. 40% of Americans are dealing with a family member's drug or alcohol problem. Most families share the same goal as you, helping their loved one to recover and live a healthier, more productive life. But moving from worry to hopefulness, or from confusion to informed understanding isn't easy. That's where community reinforcement and family training comes in. CRAFT harnesses the critical influence of family members to actively support the recovery process. CRAFT isn't tough love or detachment, but a proven method that gets results. 6 federally funded clinical trials have shown that our approach outperforms all others. 2/3 of loved ones enter treatment. Drug and alcohol use is reduced by 50%. Clients stay in treatment 6 times longer, and family members see their sadness, worry, and anger drop significantly. CRAFT is successful with adults and adolescents, all drinking and drug problems, as well as with individuals from diverse cultural backgrounds. Allies in Recovery is the first organization to design an online home for families that incorporates the CRAFT method. We offer economical, individual, lifetime memberships. We also offer affordable institutional memberships, which make it possible for all your constituents to access the Allies in Recovery site for free. You can support your clients' recovery goals by guiding families to the site or by using the site to run family intervention and training sessions. Family members will learn the most effective ways to respond to drug and alcohol abuse. Video modules give concrete suggestions based on sound psychological principles, and exercises prompt members to reflect and record specifics about their loved one's use. Recovery is a process, not an event. Our site teaches families the essential skill set, what to say and do when faced with addiction. We provide a platform for families to reach out and find like-minded people. We offer ways to calm down and restore hope. We've created a space for interacting with experts and becoming educated on treatment options. Allies in Recovery puts a special emphasis on personal safety as well as privacy, and our resources are available 24/7. We are a warm place with a heartbeat, to which family members will return again and again. Original illustrations, features like the sanctuary, and personal interaction with experts make us so much more than just another dry medical website. Now, when a client's family member turns to you feeling overwhelmed or confused, you have a partner who will help transform them into your ally and increase the odds of treatment success. Allies in Recovery.
Just I'm having trouble advancing the slide. Yes. So the site is based on the work of Bob Myers, Robert Myers, Jane Ellen Smith, and William Miller from the University of New Mexico. We took CRAFT, which was a 200+ page manual for clinicians, and created a training program for the family based on CRAFT. And the site, which I will continue to show you through the end of this presentation, has a number of potential uses for you as a clinician, as a case manager, or if you're an administrator in a treatment clinic. You could see possibly putting a private kiosk in the wait room that allows families who may not have access to the internet or a computer to go into their site, their membership account, and look at the site. You could run videos of the modules in your wait room. It's an instant family program. I have hospitals that are using it with their family programs, that family members come on Saturdays to see their loved ones and do some CRAFT, follow our program with a facilitator on Saturday mornings prior to seeing their loved one. You can print exercises, you can print the script, you can use them as group exercises or assign them as homework. You can watch a video in a group and run a discussion afterwards. This is an instant curriculum for you and your clients to use, who are the family members. Also, over the last couple of years, Lori McGoogle and I have started working on REST groups. These are support groups that are CRAFT infused. There's a number of them around the country now, and I've given you the link there. So what is CRAFT? I'm going to give you just a very shorthand run through CRAFT. We don't have a lot of time. So we always start out by teaching the family about addiction. Now keep in mind that we're not working with the person with addiction. We are working with their family member, perhaps a parent, perhaps a child, a grandparent, an aunt, a partner. And we're teaching them the fundamentals of what they need to know about addiction in order to be of help, and also be understanding of what's going on in the family and in themselves as the family member. So we include talk about harm reduction, about the literature on moderation, we summarize briefly, and we really focus on recovery. And this is something Bob Myers at the University of New Mexico didn't do enough of in our view. Recovery, the hope of it, what it looks like, what early recovery looks like. Families need to know what that cycle looks like. And then we teach a lot of skills. So it's educating about addiction and teaching and practicing new skills. And the ABCs, the antecedents, behaviors, and consequences of your loved one's use, an incident of use. We're going to teach you to have a practiced eye, to pay attention and focus on what's essential in your relationship and what your loved one is doing, and how to respond to it. And you're going to put aside a lot of other things that really are not critically important, like the color of their hair or where the jeans land on their butt. You know, so it's not about arguing over everything. It's about putting down the argument and looking with an awareness that you haven't had before. You're going to learn how to communicate. This is critically important. 70% of relationships are probably based on communication, and communication is vague, and often people feel like they're walking on eggshells, or they're not able to discuss things frankly. And we teach families very basic communication skills that open up discussion with your loved one. We are really looking to de-escalate conflict and have you, the family member, be calm and collected and understanding when you approach your loved one. We want you, the family, to stay safe. We've put a whole module together on safety because you're on a website and not working with somebody or a facilitator. So you're the one that's going to have to decide what's safe. You're going to learn behaviorism, just the 101s of behaviorism, what to do, how to respond, how to behave, how to step in when your loved one's not using, how to step away when they are. We're going to teach you, the family member, the basics of cognitive behavioral therapy. We call it just CBT Light. This is an addition to what Myers and his colleagues did at the University of New Mexico. We felt that the need to address self-care went beyond just practices of self-care, but to help families understand the basics of cognitive behavior. The idea that somehow thoughts affect feelings, that you have a thought before you have a feeling. We're trying to teach the family to take just the briefest pause between experiencing something and reacting to it. And we do that by teaching a little CBT Light. Finally, we looked to teach the family about change talk. This is all motivational interviewing. Bill Miller, really one of the first to really develop and push out motivational interviewing, was part of the group that designed CRAFT. And he was clear that motivation to change was what families needed to look for. And without realizing it, many were missing moments. Or conversely, they didn't see any moments ever. And there were moments. We call it very quickly a wish or a dip. If you're the family member and your loved one's sitting on the couch and he says, just wish I could maybe go back and take one course in college or something. And you'd say, wow, that's a wish. You know, I'm so glad to hear you say that. You know, I think you would do really well going back for one course. I think that's a very reasonable thing to think about doing. I wonder if the pot is getting in your way. Do you think maybe if we added a career coach to what you're doing, you might get to your goal of going back for a course? So a wish or a dip. The change talk is I feel so down. I don't understand why my life is going this way. I don't seem to be able to do anything. You know, that's a dip in your loved one's experience. And again, you're paying some attention to the what they're saying and what they're doing in a way that's really tailored to this craft work. So you're able to see it much better. And when you do hear change talk, you're going to learn how to intervene and engage your loved one into treatment. It's a very small intervention. It's one that comes after you've de-escalated and you're communicating better, you're responding better, you're not as reactive. Maybe 4 or 6 weeks of practicing these skills, and you're going to see a huge change in how you're responding to your loved one, and this influences your loved one. So by the time you're ready for the intervention, which is the original largest goal of CRAFT, was to get your loved one into treatment, You've built a bridge. Your loved one and you are talking better. I heard a mom tell me once, he stays in the room when I walk in now, right? Because there's just this, everybody in their corner, everything's vague, nobody's talking, everybody's ignoring and acting as though the drug use is normal. So it's a complete picture over 4 to 8 weeks that you learn as a family member to really change up what you're doing in such a fundamental way that craft can get 60 to 70% of loved ones who are resistant to change into treatment. And they do it around the kitchen table without an interventionist. We teach them how to script it out and how to say things in a way that is going to lead to a positive response, going into treatment, staying in treatment, early recovery, possibly a loss of recovery, a relapse. You're going to need this essential skill set for your entire life as a family member. And if you're a clinician listening to this, you could see how much important information we're giving to the family, how much you don't have to say, how much you don't have to repeat, or you're so busy that you don't have time to work with collaterals the way you would like to. This is the way to teach a family member how to behave in a way that is the most likely to get your loved one to enter treatment and recovery. I'm going to show you one study. There are a number of studies. This was one of the earliest ones, 1999. 130 family members, their loved ones were all struggling with alcohol. They were assigned to one of 3 interventions, an Al-Anon facilitation therapy. So that's very much like AA facilitation. You go to a session and you're taught, what is Al-Anon? How do I get there? What to expect? What's the literature look like? All of that, right? So that it's like AA facilitation, but for Al-Anon, 12 sessions. Johnson Institute intervention. They created a 12-session intervention, and then craft, 12 sessions with a clinician, a master level clinician. The facilitators of these sessions were adherents of the approach they were using. So somebody in Al-Anon, somebody with a Johnson Institute background, and somebody trained in craft. You see the family characteristics. Families tended to be older, hugely female, 85, 91%, 85% on our site, 85%, I believe, in Al-Anon are women. In this study, half about were white and 40% were Mexican American, Central American. The treatment engagement rates show that Al-Anon got about 14%, which is high for Al-Anon because it's not designed to get a loved one into treatment. Johnson Institute got 22.5%. The problem with the Johnson Institute is that the families don't go through with it. There are sessions that to organize the family. The family's supposed to write a letter, what your alcohol use is doing to me, how much I love you. But families don't follow through. So the percentage of people that actually succeed with a Johnson Institute intervention is relatively low. And you see that for craft, close to 65% of families were able to get a loved one into treatment. For all of these studies, the treatment was outpatient therapy, unless, of course, detox was necessary. And that outpatient therapy was provided by the University of New Mexico. Here is a depression scale that the family member. Again, we're not working with the client, the person with addiction. We're just focused on the family member. And it's a 12-session, 12-week course, craft. So at month 3, you see where depression has started to go down. So you're seeing the effects of skill training for the family and a feeling of hopefulness and capability for dealing with a situation that has felt completely out of control. But look what keeps going. Month 6 and month 12, depression continues to drop. So these families have learned skills that are making a difference in the lives of the family member, sufficient to drop depression over time. This is a very bad slide, but I wanted to just point out some of the studies that have been done on craft. You see in the third column, once they went from alcohol, they tried families whose loved ones had cocaine and opiates, and it was successful, you see at the bottom. Then we wanted to see if craft was culturally appropriate for non-white Western families. And a study was done by Myers and Miller, also in '99, with 80% Hispanic, and they got a 74% engagement rate. And then if you keep going off to the right, Waldron et al. Did this work with families of adolescents, and it worked very well. And then finally off to the right, Manuel was a grad student of Bob Myers, and she created a craft group. Craft is done 12 sessions individually with a master's level clinician. It's very expensive to do. So she created a group of craft and found that the group got 70% into treatment. Her control for that study was a book written by Bob Myers called Get Your Loved One into Treatment. And that is addressing the family member. So it's a consumer book. It's for the family. It's not, we're not mediating through a clinician of any kind. But the book alone, the control group got the book, and the book got 40% of people to get their loved ones into treatment. Other outcomes that are notable is the number of sessions craft engaged loved ones or clients go, attend, stay for, don't drop out. It's 6 sessions as compared to 1. The majority of loved ones stayed in treatment for 6 sessions, whereas the public treatment system data showed for New Mexico a state modal of one session. Also, loved ones reduce their use by 50% when a family member works with craft. And we do this just by reducing the number of hours in the day, perhaps, that your loved one is using, by encouraging them to do something alternative, something that competes with that use. There may not be much, but perhaps going to friendlies competes with a Friday night where your wife might normally stay late at work and go off to the bars afterwards. So they followed with 7-day weekly summaries of their loved ones, and family members tracked the drop in use. So now I'm going to tell you a little bit about the family, because we know a lot about substance use disordered people, and we know very little about the family. We know from a Hazelton poll taken back in the 90s, I believe, that family members have increased depression, increased anxiety. They harm themselves at work. They're not paying attention. They're distracted. They're absent from work. There's sleep and stress-related conditions, of course, family conflicts and problems. And family members end up the de facto untrained caregiver in a very, very fragmented treatment system. Families are often marginalized. They are seen as enabling or codependent or the victim. They might be limited in terms of their ability to talk to the treater because of HIPAA, or not consulted, even though they want to be consulted. I was just on the phone with a treatment agency, and I have to get the young man to make the call to get on the wait list. His mother can't do it either. Families are seen as peripheral to care. There's no reimbursement for craft. There's no reimbursement for this evidence-based care. You have to have the IP, or the identified patient, in the room. And so for craft clinicians, traditionally, they are either out of pocket, or they have to be diagnosed, the family has to be diagnosed with adjustment disorder or depression or something. And it's very hard to find craft clinician in this country still. There's probably not more than 100 family craft clinicians. Families care deeply about what's going on right now. They want to marshal their energy, their loyalty, the power. They provide resources, and they are the ones in the nearest environment to the person with addiction. They know that person very well. They're an untapped and critical resources. They're right in front of us. They're right there, embedded in the community around the person with addiction. And the behavioral science of what to do is right in front of us as well, and that's craft. This is a study, let me just check my time. This is a study out of Kaiser Permanente in 2010 by Wiesner. And it showed family medical and psychiatric conditions were significantly greater than controls. And so Kaiser Permanente was able to follow both dyad of the family member and the loved one, because they were in their system. So they could see what was going on with the loved one with addiction, and the cost of medical care for their family. And the correlation was really high, so that even if the loved one had really severe addiction, their family typically had more serious mental health concerns. In fact, if you have a family member, if you have somebody in your family with addiction, you actually score higher on chronic conditions, such as asthma and diabetes. You fare worse, than somebody with asthma or diabetes. And depression, which is in controls in 5th place in terms of mental health conditions, is 2nd if you're a family member. This is a graph that shows over 5 years. The diamond at the top is a family member who's got a loved one who's now abstinent. You see on the left, the cost there at the beginning is about $130 per month. You have the controls, which are the triangle along the bottom, and then you have a family member whose loved one doesn't get into recovery, doesn't become abstinent, doesn't reduce their use to the point where they're able to function and lead a healthy life. Well, then the cost of that family member's monthly health continues to rise over 5 years. So if you look at the diamond, you see that the diamond over 5 years, if your loved one gets into recovery at 5 years, your own healthcare costs go back down to the same point as the control. So I'm going to just I have 15 more minutes. I'm going to just run through these slides, which is a breakdown of the craft approach. I'm just going to skip through them because I went into a little more detail than I meant to in the beginning. So you've seen the way craft works. You can read about it. There are lots of studies. There's several craft infused programs, if you will. Smart Recovery is running family and friend sessions, and they use craft. The Center for Motivation and Change has started the Invitation to Change, which is based partly on craft. I'm sorry, things are very slow. So what we do on our site, in addition to modules of craft, data-based set of questionnaires that you answer with multiple choice questions. You don't have to download anything or print anything. It's very quick to go through the questions. The questions help you do that functional analysis that they do with behaviorism, right? They teach you what happens right before the person uses, right during that use, and right after, the short and long-term consequences. And so what we do on the site is we teach craft, and then we have an expert blog where people send in their situations, and we apply craft to their situation in a way that we're also educating the rest of the community. So it's a public blog. People send in sometimes 2-3 pages of their situation, and we apply craft to their situation. I want to just read you a few answers to these tailored applications of craft. And we have, at this point, something like 32 single-space pages of comments from families, 95% of which are unsolicited. And this is simply the last page. I'm not cherry picking at all. I'm afraid to write this for fear of jinxing our situation, but this site helped spark monumental changes in my family, and we are all so thankful to Allies in Recovery. I've been seeking help for over a decade. My son simply could not function in the outside world with his pot addiction and binge drinking. I know people who function well on perpetual pot, but it has a huge effect on my adult son. Here's how our lives transpired when I found this website. I followed the videos and cut down on my negative talk and waited for a wish or a dip. I prepared what I would say when it came time and using the suggested template. I found a treatment center that I thought would resonate with them. I called them and let them know we were interested. I also asked them for tips on how to talk to my son. I knew it would not take long because he already had a lot of wishful thinking, though I was prepared to go 6 to 8 weeks. When the dip came in week 1, I took a deep breath, followed my template, and my son agreed to look at the Recovery Center's website. Within 2 minutes, my son said he was ready to go. He wanted to go. My son is now in his 5th week of outpatient treatment. He loves the treatment center and said it's the most meaningful thing that has ever happened to him. He is helping others. I am filled with optimism. Your Allies in Recovery website gave us strength, a plethora of guidance, and most of all, an understanding of what our loved one truly needs. Thank you for this post. I came to Allies in Recovery almost 2 years ago as the second stop. SAMHSA was my first, on my journey as a parent of someone struggling with their SUD. How fortunate that my early learning took place here. I learned much of the language early on, and the tone of conversations here were full of hope and compassion for our loved ones. My daughter is skittish by nature, so the language I use is especially important. I don't get the full honesty from her that I would like, but I understand that honest communication is too revealing for her at this time. I am responsible for me and my choices, including the language I carefully choose. Finding craft has helped build a foundation built on love and hope. Thanks again for this thoughtful post. And one last one. I read the response Dominique gave me in her blog about my question. I would like to thank her so much. I feel so helped and supported. Thank her so much. I do my exercises and modules, and I find it inspiring and very helpful. It gives me joy to think what I can do to reward him being sober. It also helps my feeling much better, even joyful. It gives a very good sense of direction. So in 2017, we were live in 2015. 2017, I took a member survey. We got 350 people who had been to the site 3 times, and we got close to 50 of them to respond to a very brief survey. And I just want to give you the responses. 80% found the site extremely or very helpful in improving interactions with their loved one. 45% found the site extremely very helpful in improving how their loved one responds to them. 68% found the site extremely or very helpful in reducing worry, stress, or anger. And here, this is compared to the craft studies in which they had significant reductions in the families for anxiety and depression. 35% found the site extremely and very helpful in reducing how much their loved one uses drugs or alcohol. We found, the CRAFT studies found 50% of loved ones reduced their use. 58% found the site extremely or very helpful in engaging their loved one into treatment, formal treatment, self-help, or recovery supports. 58% as compared to 66% on average for a family trained in CRAFT in the standard way. 51% found the site extremely or very helpful in supporting their loved one to stay in treatment. So this is the retention. 50% were able to retain a loved one in treatment. And this again is compared to the 6 options versus the 1 for those families trained in CRAFT. Finally, I want to give you an idea of what this costs, which is almost nothing. What we have done is scalable. Insurance doesn't pay for it, so we had to make it very inexpensive. Right now, it's $39 a year for a family member. Our hope is to get institutions to offset that cost. We have institutional rates. The whole state of Massachusetts, for instance, has a license to this site. We support the state. We support it through pushing out messages onto Facebook. We have the cards we hand out. We printed over 25,000 cards to give clinicians and case managers and other treaters in the state of Massachusetts. Even conservatively, 12 hours of a master level clinician could run about $2,000. In February 2018, the cost to treat one family with CRAFT dropped to $51 with the help of the state of Massachusetts. We had the whole state so we could follow the amount the state is charged for how much it costs for one family in that state to get trained in CRAFT, $51. We're rising by 2 to 3% a month in members, 40% per annum. So the scalability of it drops the price. In February 2018, we were at $51 a member. By May, $44. The end of this year, it'll be $21. And again, for the state of Massachusetts, by 2025, it'll cost them $6 to provide CRAFT to a family member in their state. So
Great, thank you, Dominique.
You're very welcome. No, I just wanted to say, I was looking to see if I had a closing, but I don't. So go right ahead and thank me. But this is my information if you want to get in touch with me.
Perfect. I'll leave that up for a little while as we start to get some. We have a couple of questions that have come in, so I'll just read through those, and then I have a couple of closing remarks. So we'll just kind of give people an opportunity to look at this slide, and then I'll show our survey link again. A question, well, more of a thought and a question. It says, I am wondering if there was a control for response bias for reduction of depression in the first study.
No, the first study was a comparison of Al-Anon, Johnson Institute, and CRAFT. So it was a comparison study, no control.
Okay. Another one that came in is, how did you come to develop this site?
I was in 2001, I was evaluating programs in Springfield, outside Springfield. I've been an evaluator for SAMHSAs and HRSAs for 25 years. And before that, I was hiding out in grad school. I was newly abstinent from IV drug use and alcohol. And graduate school sort of suited me well. It was sort of like not quite getting into the real world. And I came across a CRAFT poster at a SAMHSA meeting I went to. I was supporting myself as a researcher on those SAMHSA grants. I just thought that, the nature of families and the nature of addiction, it seemed to me that it made so much sense that there was a theoretically based philosophically sound approach for the family to take when faced with somebody's addiction. And craft did it. I got in touch with Bob Myers, and we started working together on training clinicians in a sort of classical clinic. That's what I had pretty much started in 2003. We did craft the traditional way. And I kept coming up against barriers. Families don't matter. Families, there's no money for families. Their insurance wouldn't pay for it. So it became very difficult. We made groups. We did everything we could. We provided a lot of free craft, and we really learned craft over those years from 2003 to 2015. I launched in 2015 a website. I felt that this was going to be the best way to reach the largest audience. It kept me from having to repeat myself over and over. It was the best of the trainings, the best of the work that we had done. At this point, we had a lot of experience working with families, and we weren't sharing that experience with other families. And so the website turned into the perfect method for getting craft out. That was in 2015. So that's where we are today. I'm able to put recovery and hope into the craft work. We added a lot of compassion and understanding of what families are going through in our responses, expert responses to folks writing in. And I feel like everyone in our team has experience in this, and it's really a labor of love, because I am the founder and unpaid CEO of Allies in Recovery.
Wonderful, thank you, Dominique. Here's another one that came in. Is there any data on the use within a medication-assisted treatment environment?
Yes, we are running in several methadone clinics. We trained all the clean slate case managers out in the East here in Massachusetts and in other states. It works very well with a medication. The family, we've talked to Boston Boston University, and they're interested in creating another module that would be specifically for families of loved ones who are on a medication.
Okay, here's another one. I think, hopefully I'll read this one correctly. Are there possibilities for a family member to use motivational interviewing to de-escalate the disconnection of the individual?
Yes, of course. I mean, motivational interviewing, if you look at some of that early work, the specialty was getting people who don't open up to talk. So the reflective listening that we teach on this site, and other helpful motivational interviewing skills, basic ones, nothing too complicated, makes a huge difference in families when their loved ones seriously doesn't stay in the same room when you walk in. There are very solid ways that motivational interviewing has been integrated into all the work of craft. It's resistance. Remember, the original population that this was designed for was the resistant user. So it's very much about the skills of motivational interviewing for that resistance, for that person who isn't opening up, who isn't calling, who isn't otherwise connected with you.
Okay, are there any modules that are specific to community corrections available?
Nothing specific to community corrections, though I've worked in corrections for many years, and we've been doing craft groups with families whose loved ones are in community corrections. And it works very well, though it's, of course, when there's criminal justice involvement, it's always more complicated. And with some families involved with criminal justice, it's simply not one kid in jail or one husband in jail. There's so many major life difficulties, poverty, and other people in the home who aren't well or are in need of help. So you end up doing a lot more family case management, not just for the person who's in the group in the moment, whose loved one is in criminal justice or is in jail or in community corrections. You end up helping that family with other members as well.
Great, thank you. Let's see. How do you get the state involved to subsidize?
Well, I knew I was known in Massachusetts because I had done so much evaluation, a lot of it for the state. So I was able to get in and talk to people in a way that I haven't had as much success in other states. It's very hard. Every state is different. I have been banging on state doors now for 5 years and have only been able to get Massachusetts and Rhode Island. Rhode Island doesn't have a full statewide license. We work another way with them. And Ohio is interested. I am talking with other states. Every state is, California, for instance, it's at the county level, right? You'd have to go to each county and talk to them. New York, too, has its own way of funding. So it's a long slog getting to the states. My colleague, John Fitzgerald, who couldn't be here today, has been working with the state of New Mexico and having some success, but things move very slowly.
As do a lot of other things.
Especially now.
Hopefully I'm summarizing this one. The resources on the website are geared for patients, of course, but wondering how I can get information for providers as we are starting our own OBOT program in a high-risk pregnancy clinic.
So what? So you're looking for help with the families of high-risk pregnancy, young women.
It sounds like it. It's hard to tell from the chat, but yeah, that's what it sounds like.
Nothing, whether they're pregnant or not, high risk or not, an outpatient medication program is going to use this method, this tool, the same way. You would. And we have families on the site who have loved ones with young children or loved ones who are pregnant and on the street. So I mean, we're talking about outpatient treatment, and we're talking about treatments that perhaps need to be combined to get a full comprehensive treatment plan for someone. And so CRAFT would provide any resource. We also provide a method for looking for treatment that includes going to the SAMHSA website and looking at grants, state grants that have been funded. There are lots of ways to provide resources. CRAFT is CRAFT. It's a set of principles. It's a universal, and it's all about how you apply it. And the application of CRAFT depends on who you have in front of you. If you have the family of a high-risk young mom to be, then yeah, you're going to need the resources for. In our state, it would be the Institute for Health and Recovery. You would need specialized help, but we do know about it, and we can help you locate it. And we have a system to follow, a methodology to follow that helps you find treatment when you might not find it otherwise.
Great, thank you. It seems like we've gotten a lot of comments saying thank you and that they would like to reach out to you. So I'm glad that you posted your information up there. I'm just gonna go ahead and do a couple of closing remarks. If I could get to the next slide here. Oh, maybe not. There we go. There. So please remember to fill out our survey for today's webinar by clicking on the link that will be within an email we'll be sending out later today. It's also provided on the screen there and within the chat box. And be sure to join us for our next webinar on July 29th. It's titled The Vital Role of Recovery Housing in the Continuum of Care, and that's presented by Alan Mua. It seems like we've gone through all of the questions, and the rest are just comments saying thank you for your time, Dominique. We really do appreciate you taking time out of your day to speak with us and present today. And
I'm very grateful to have had this opportunity to talk to you. I just wanted to remind everybody that we made the site free through COVID. So at least through the end of the year, there's no cost to come take a look. So I really encourage you, when you're done with this presentation, to just go back to your computer, punch in alliesinrecovery.net and have a look for yourself. Thank you.
Thank you, everybody. We appreciate you, and thank you for making the site available for everybody. We appreciate that. Take care.
Thank you.